Good evening, everyone. Tonight we get an insider's look at what it was like in a Nashville nursing home right in the middle of a COVID-19 outbreak.
News Channel 5 Investigates has already exposed how health department emails show the Trevecca Center for Rehabilitation and Healing was slow to react when staff and residents started getting sick.
And tonight, one nurse describes pure chaos to our consumer investigator, Jennifer Krause.
My worst day in emergency room was never that bad.
Connie Houston says nothing in her career as a nurse prepared her for the months she spent at the Trevecca Center for Rehabilitation and Healing, right in the middle of its COVID-19 outbreak.
I was there April 1st, 3 days a week until April 26th. And
Furloughed from her nursing job at a surgical center in town, Houston turned to a staffing agency that placed her at Trevecca. And her very first day on the job there,
we were told that there had been a nurse that had tested positive for the coronavirus.
Houston says for the next few weeks, even as another employee tested positive and residents started showing symptoms as well, the message from managers at Trevecca was always the same.
They told us that we were not to mention the coronavirus around any of the patients because the patients were starting to ask questions. We were not to talk about it if there were any EMS. Like when they came, brought patients or took patients, we were not to say that there were positive patients. We were not to even nothing.
But Houston says the virus was clearly making its way through the facility.
They had sent a couple patients to the emergency room because they had gotten sick overnight. And most of them were respiratory.
But Houston says nothing changed. Nurses got no additional PPE. Residents who had fevers were told to stay in their rooms, even with roommates who had no fevers. And the facility, Houston maintains, remained woefully understaffed.
I said multiple times that if the state went in there on just a pop visit, there's no way that place would pass.
Yet when the state health department sent inspectors in on April 7th in the middle of all this to determine whether Trevecca was following protocol and whether it had an appropriate emergency plan in place, regulators found no deficiencies or issues.
So are you surprised to hear that they passed with flying colors?
Yes, very much.
2 weeks after that state inspection,
17 people there tested positive for COVID-19.
Came word that there were 17 cases at Trevecca, and by the next day, it had jumped to 45. Houston says she came into work that morning and it was unlike any day she's ever worked.
It just was sheer chaos for nearly 12 hours.
No one, she says, appeared to be in charge, and very little information was shared with employees.
They would not tell us what patients were positive at all.
Houston says staff frantically moved residents to other halls and floors without any sort of explanation, including 15 of Houston's patients.
Did you believe that these were patients you had been taking care of and they were being moved because they were positive?
Yes.
And while COVID-positive patients were supposed to be isolated, Houston says they all ended up being mixed together and cared for by the same staff, who wore the same PPEs with all of them.
And why did you think that was wrong?
Well, because you cross-contaminate.
On top of all this, Houston says nurses were routinely assigned up to 20 patients at a time.
You can't adequately be a nurse to 20 patients.
And rarely, if ever, she says, were they provided much information about the patients that might help in their care.
Yeah, I asked one of the techs, I was helping her with something, and I asked her why the patient was there, and she says, I don't know, they don't tell us.
The latest numbers show 59 cases of COVID-19 at Trevecca and 4 deaths. And Houston sadly admits she's not surprised.
I just think that they put the patients at risk, and along with the staff.
Just days after that chaotic day that Houston described, she tested positive for coronavirus. She says she never showed any symptoms, but it did keep her from returning immediately to her job at the surgery center. Jennifer Krause, News Channel 5 Investigates.
Thanks, Jennifer. The administrator of the Trevecca Center told us their staffing ratios are above industry standards and that the Trevecca Center will continue to take all appropriate measures, including appropriate consideration of PPE, isolation and care in cooperation and coordination with health officials.